I'll repeat myself. Um, okay, I'm Dr. Kane. So nice to meet you guys. Tonight we're going to be talking about how to engage with medicine. Thank you all for telling me that you couldn't hear me. We'll start with a brief agenda. First, we'll talk just very briefly about me and my background. We'll talk about the purpose of shadowing and how many applicants do shadow and how I think you can make the most out of shadowing and then move on to something else. And then we'll talk about some ways to get involved more actively with medicine and some unique opportunities to stand out. And then we'll also do a live Q&A. So I can just throw this in the chat now. I'm going to put a form in the chat. This way, this is a link to a Google form. So if you have questions now already or that come up throughout the session, you can enter them in the Google form. And that's how we'll do the Q&A portion. It'll be an interactive live Q&A. Any questions you ask, I'll try to get to. And if I don't get to them, if you leave your email, I'll send you an email response. All right. Oh, and I should have mentioned you can put any questions in there, whether it's about shadowing, how to engage with medicine, med school applications, or anything. Everything's fair game. Just a brief little portion about me. I did my undergrad at Lafayette College. I majored in neuroscience and I minored in creative writing. I grew up in Connecticut, so lived on the East Coast most of my life. I ended up doing medical school at UConn. I had got into a few different medical schools on the East Coast, but to be honest, I gravitated towards UConn for the in-state tuition, since it's like half the price of most med schools if you go in-state, and I didn't want to have all the loans. But I felt like it was a really good decision. I got excellent training there, and then I was able to match at a Harvard residency. So now I am in an internal medicine residency at Beth Israel Deaconess Medical Center, which is one of the three Harvard hospitals in Boston. Um, and I'm very happy here and happy with my decision. I'm in my final year of residency. So I'm a third year senior resident, and then I'm going to be doing a chief year in 2027. And I'm the founder of Docera, which is the host of this webinar. And we'll briefly talk about Docera and some opportunities for you all to get involved with our program later in the webinar. And then I guess I always share with my talks. Some of you are my students here. I recognize your names. And so you've probably heard some of my spiels about what I enjoy in medicine, but I always like to share something that I enjoy. Um, Oftentimes I talk about how I like, I guess I'll share this one tonight. I really enjoy one thing about medicine is that all of my patients that I meet, I feel like just immediately let me into their lives. And the trust that you have as a doctor with people is really just something that's like unmatched. I feel like when you're a doctor and a patient comes to you and they're very in a very vulnerable place and maybe on one of like the worst days of their lives and they're looking to you for your opinion and your guidance. And I just don't really feel like there's any other job in the world where you have that privilege and someone just that you meet just immediately lets you in to their darkest times and the darkest corners of their life, and you help them navigate through it. And then it just kind of creates this like really special bond between you and your patients. And I just have a lot of moments already in residency, only 3 years into being a doctor, that I will just like never forget and will cherish some moments that I've had with people. It's a very like human career. You get to see like all people from all walks of life and all backgrounds. And I think it's just really special. And I wouldn't trade it for the world. So I highly recommend this as a career. And tonight we're going to talk about how we can get you guys there. So, what is the purpose of shadowing? I think shadowing exists for like a few reasons. I think it has a very clear role, and I think sometimes its role is overstated. And so that's part of the reason behind wanting to talk about that in this month's webinar. I think shadowing really exists because it allows students to confirm that medicine is the right career for them. It helps you to kind of like see like what is a physician-patient interaction like. It gives you an idea of that. Some students use it as a way to experience different specialties to see if they like surgery, for example, or whether they like medicine. Although, as I'll talk about later, I think that's something that could actually be saved for medical school, since most people don't decide until much later anyway what they want to do. And then understanding the realities of clinical practice. So what it's like really like to be a doctor, and to demonstrate to admission committees that you've like explored your career, the career that you want to go into, and that like you actually know what you're getting yourself into. So I think that's kind of like the purpose of shadowing. I think a key point to mention is that shadowing was never intended to empower students to deeply engage with medicine. It's intended for these things, right? It's intended to help you if you think you want to go into medicine, like see, like, well, what is medicine like? And and I think that's kind of its role. So should you shadow? Yes. Like this webinar is not going to try to dissuade anyone from shadowing. Mostly because I was looking through some data, 90 to 95%, so almost all medical school matriculants, meaning people who applied and got into medical school, report that they shadowed a physician. And the percentage kind of varies year to year, but it's close to 100 most years. And so I really wanted to share this because I think it reframes shadowing as something that is expected rather than something that differentiates you from other people, right? So if almost every single person who got in is shadowing and people who are applying are shadowing, like the fact that you've shadowed doesn't make you different from the other applicants, right? It just makes you be able to be in the pool, if that makes sense. So it's something that committees really like expect everyone to do. It doesn't help you stand out though. And so I think a lot of kind of admissions counselors or companies or other people might try to push this narrative that you should get as many shadowing hours as possible. You should shadow as many different specialties as you can. You should try to get 200 plus hours of shadowing. You should continue adding shadowing through high school, through college, like all the way until you apply. And the more physicians you shadow, the better your application. I'm kind of here to debunk this tonight. I don't really believe all of these things. I think that the result of all doing all of this or listening to this advice is that many students spend like hundreds of hours observing medicine without actively engaging with it, and then they don't stand out from a crowd. Um, and so if all you do is kind of shadow, then you don't really have much to show for it, right? And so I think it's important to shadow. And I saw in the chat, how do we find shadowing opportunities? I'll address that question in the Q&A. That's a good question. Um, and I just wanted to point out that I think shadowing is important. You should all do it. We can talk about ways to find opportunities to do it. But I think that it has diminishing returns, right? If you shadow, the more you shadow, like you hit a point where you're not really gaining anything extra. You're just kind of showing the same thing to the admissions committee, if that makes sense. And we'll talk a little bit more in depth to clarify what I mean. This is my perspective on shadowing. I think shadowing demonstrates that you've explored medicine as a career, you've observed the responsibility of a physician day to day, you've gained some amount of exposure to patient care, you've confirmed that medicine is a profession you want to pursue. That's the role for shadowing, right? Once you've achieved those goals, and you can reflect after you shadow for a short period of time on if you feel like you've achieved that, then I think additional shadowing hours often don't add very much to your application compared with experiences that require active learning and engagement, right? So I think once you've accomplished these goals, you should move on to something else that can add something else to your application. Okay, so instead of trying to shadow as many doctors as possible or build like pick up all of these shadowing opportunities and go in all of these different fields and meet all these new people, when you shadow, I would recommend that you pick one physician and you stick with it. Okay, I think that there is plenty of time once you enter medical school. There's years of this in medical school where they make you try every single specialty and you get to decide what's best for you. I think that doing it in high school is not necessary. I think if you pick one physician and you shadow them a few times, then you get the gist. And I don't think you need to spend your time going to multiple different types of physicians. I think that that time could be better used on other things in your application to help you stand out. And we'll talk about what I mean by that. But I wanted to give an example that when you do shadow, if I could go back in time, this kind of is what I did, but in an ideal applicant, I think you would shadow one physician in a specialty that you're interested in. So you think you're interested in the ER, find an emergency medicine physician, reach out to them, try to shadow them over a longitudinal period of time, right? You don't have to go in and do 40 hours 1 week and then never go back. We would much rather see you do 2 hours a week for a year, for example, and get to know that physician over the course of a year. And then they can write you a letter of recommendation, for example. So if I had to frame this more clearly, I think the purpose of shadowing, right, is to confirm that you like medicine. And ideally, being transparent, I think shadowing is great because it can get you a letter of recommendation, but only if you have a good enough relationship with the physician you're shadowing, right? So you have to reflect on what your goals are. If you don't have enough people to write you letters of recommendation, for example, then maybe your goal is to get a letter through someone you're shadowing. And if that's the case, you need to spend more time and you need to do it over a longer period in a longitudinal way rather than stacking all the hours. Meet with someone for 2 hours a week for 10 weeks, and then they get to know you better than just cramming it all into 1 week, if that makes sense. I know this is a lot, and we'll go through some more similar stuff and I can answer questions at the end. So should you shadow 200 hours? I would say probably not, right? I know a lot of people out there on the internet say, I shadowed hundreds of hours and I got into medical school. I think that this is absolutely not necessary. I got into multiple medical schools only shadowing 40 hours, but I had a lot of other experiences that helped me stand out from a crowd, right? If everyone's shadowing and you've spent all of your time shadowing, you're not standing out, right? You're just kind of like everybody else, except you have more hours of that. And so, while there is no required number of shadowing hours for admission to medical school, after like you get that meaningful exposure to medicine, you should kind of consider whether additional hours are the best use of your time, right? So ask yourself, would another 100 hours of observing teach me more about the field or help me grow as a future doctor? And for many students, the answer is no, right? Once you reach a certain point, you've gotten what you can from the experience, and more hours of that is not going to help. So, one way I like to think about this is opportunity cost, right? So, when you're doing one thing, you're dedicating yourself to that one thing, you're missing out on a lot of other things you could be doing, right? So once you've gained the meaningful clinical exposure from shadowing, and you say you've done 40 hours, you feel like you've accomplished your goal of understanding what vaguely what it's like to be a doctor, what the day-to-day life routine is. Maybe you were able to get a letter of rec from the doctor you shadowed. Okay, it's time to move on, right? How could you spend your next 100 or 200 hours? Should you just continue observing medicine, doing the same thing, getting the same thing out of it that you've already gotten? Or should you pivot and try to actively engage with medicine with experiences that demonstrate initiative, intellectual curiosity, a deeper commitment to medicine, and something that's helping you grow as a future physician, helping you mature, helping you become a better thinker, a better practitioner. And I would for sure advocate for the second, right? That's what the admissions committees want to see. Somebody who has a diverse portfolio, not somebody who's just used all of their time or majority of their time to shadow. So when choosing your extracurriculars, ask yourself, does this allow me to actively engage in medicine, or am I simply observing? Okay, I think that's a really pivotal question. And I think most people who are applying have a lot of experiences that are passive. And if you can find experiences that are more active, it will help you stand out. Okay, so ways to go beyond shadowing. Some of these are things that I did myself. Some of them are kind of just other things that I know students do. So you could provide direct patient care. You could get an EMT certification and work at an ambulance. You could get a certified nursing assistant certificate and work as a nurse's assistant. You could be a medical assistant. You could be an emergency department tech. These are all things you could do once you're like college level. Okay. You can also support patients in crisis. So one thing I did as a college student was become a crisis text line counselor, and I supported people who were having mental health crises as like a suicide hotline responder. Was a volunteer role that I had in college as part of my application. You could do clinical or basic science research, but I think a lot of you already know that's all always in the rhetoric to do some research. You could work on quality improvement projects. So a lot of people I feel like who are pre-med don't really know what these are. Um, Basically, at hospitals or doctors' offices, there's always QI work, we call it, going on, quality improvement QI. It's basically like work to improve the practice or the quality of medicine that's being delivered at a hospital or a clinic. So, for example, you could do a QI project on how to increase the adherence to cervical cancer screening at a clinic. And you could work with a physician to try to increase the percentage of women who are getting pap smears for cervical cancer screening. That would be something like a QI project, right? So it's different from basic research where you're pipetting in a lab. It's a little bit more hands-on where you're learning the systems of a practice. So that's more engaged, right, than shadowing. Medical writing is a great opportunity, and we'll talk about some stuff tonight if you want to get involved in that. Um, let's see, patient education, similarly, like as a high school student, you can make patient education materials, right? Health literacy is a huge problem in today's society. Like patients just don't really know much about their bodies or their health or the conditions they have. And you can research and create patient education materials. We'll talk more later in the talk about if you're interested in that, about how you can get involved. Journal clubs you could go to. You could host them as well. Maybe at your school, you start a club where you read medical literature, for example. You could do physician guided scholarly projects. Other just some ideas that I had, you could self-study a disease and maybe write an article about it to try to get published on a blog, for example, or start your own blog about something. You could do a medical ethics discussion or maybe start a group with your friends where you talk about these things. You could present a clinical case. You could that maybe you saw when you were shadowing. You could ask the physician to write up the case with them and present it. You could attend a physician-led educational program. So we'll talk about that. I run a few educational programs that we'll talk about as an opportunity for you all. You could do things with community health, right? You could work with a health education program. That's one of the things I did when I was in your shoes. I taught health classes to middle schoolers in underserved communities. Very simple material. I didn't know anything. I wasn't a medical student yet. I was just teaching, for example, dental hygiene, things like that. So it's something that you could be empowered to do if you had the drive or the desire to do it. You could attend health fairs or screenings, community outreach organizations, things like that. So there's always things in the community to be doing that allow you to more deeply engage with medicine. You just have to be creative, right? So if after all that you're feeling motivated, but you're not sure where to start, maybe you're wondering, how do I find a meaningful opportunity? This all sounds great. Maybe I've already shadowed a bit and I'm ready to move on to something else, or I'm looking to find both opportunities. How do I learn more about medicine? How do I make projects? How do I connect with physicians? And so if that's you, I wanted to take a few minutes to tell you about the programs that I have at Docera that I think can help you all on this journey. And then we'll move into our live Q&A. So if you have some questions that have emerged from this talk already, you can put them in the form in the chat, and we'll get to them in a few minutes here. So what is Docera? Docera, basically, I think most pre-med students spend years preparing for med school before ever truly like deeply engaging with medicine like we're talking about. And especially they don't get to learn medicine. And so Docera was created to change that. We help or I guess I'm the director of Docera and I'm the instructor, right? I help future physicians engage with medicine through physician-led education, mentorship, and project-based learning. So you learn in Docera, you would learn directly from me. You would explore real clinical topics. You would build projects and develop experiences that help you stand out. So stage one in Docera is that you learn medicine, okay? So our curriculum, most students spend years preparing for med school before ever learning things like how diseases work, right? Maybe you're shadowing in the ER, somebody comes in with flash pulmonary edema. You're kind of just there. I feel like the reality of shadowing, at least when I reflect on my experience in high school, was that I'm kind of in the corner. I'm pretty anxious. Like I'm hoping I'm coming off as polite. I hope people are hoping that maybe they think I'm a good fit or maybe they would recommend me. And I'm not really like focused actually on retaining like what's going on. The doctors are kind of just taking care of the patient. Nobody's like actively teaching me. And so it's it was kind of like a not a very fruitful experience, right? I wasn't actually learning medicine. Maybe I was in the room when there was somebody having this, but I didn't really know what was going on. This program is more designed to be like a low stress environment where you truly learn medicine, how diseases work. We expose students to medicine in a way that high school and college doesn't. Okay, and so you get to explore clinical specialties like cardiology, pulmonology, neurology, hematology, many more. You learn medical research, evidence-based medicine, genetics, immunology, medical ethics, public health, all the above. Um, and the goal is to give you a deeper understanding of medicine and discovering specialties and topics that interest you, right? Maybe you go through the curriculum and you're like, wow, cardiology is so interested. I want to go shadow a cardiologist. And then you kind of realize like this might be my passion. And when you go shadow the cardiologist, you're like, I actually kind of already know a lot of this stuff, so I can get more out of this experience. Okay. So why does this matter, right? I think most pre-med students spend years studying biology, chemistry, physics. Those are like topics that are required for you to apply to med school, but they don't know anything really about disease or clinical reasoning or how physicians think. And we are the first and only program that are bridging this gap, right? So I just wanted to take 1 minute, less than 60 seconds, to take you into our cardiac disease module so you can see what it would be like if you were in the Docera class tonight. We go through case-based learning. So our case is, in this example, a 64-year-old female, the history of hypertension, meaning high blood pressure, and CAD, which stands for coronary artery disease. You would know this in the program because you take a medical terminology section. But she's presenting to the ER with shortness of breath, worse when she's lying down, and swelling of her legs, as shown in the picture here. This is something called pitting edema, which is like swelling that pits. So when you press, it leaves a mark where your finger was. And she's requiring 4 liters of oxygen via a nasal cannula, just a nose mask to deliver oxygen, to maintain her oxygen sat. You do a physical exam, order blood work, and you get a chest x-ray, which is shown on the right here. So then we'd enter our reading room and we would interpret as a group the chest x-ray, which our students kind of like get better at as we go through the course. But this is a example where you can see here the lungs should be nice and clear. And here you see that they're very hazy. There's all of these white opacities, and that's consistent with diffuse pulmonary edema or fluid in the lungs. So this is a case of congestive heart failure. And then we would kind of walk through like what congestive heart failure is, how do we diagnose it, how do we treat it, the types of heart failure, etc. So that's just a quick preview of like the types of things we learn in our program, right? We go really deep into actually learning medicine in a way that you never have before. Stage 2, after you've completed the curriculum, you can complete medical projects. It's a win-win. I saw some people in the chat like, how do I find a passion project? I think this is a great opportunity for that, right? You can make this into whatever you want it to be. So once you prove that you've learned the curriculum, you pass some quizzes throughout and an assessment at the end to showcase that you've mastered the material, you're equipped to complete some projects. So you can choose from medical articles, writing a clinical deep dive, making an infographic, making an educational presentation or a patient education resource. And then you get physician feedback on your work. So we have over 80 physicians who help provide feedback. Most of them are residents at the Harvard hospitals in Boston. They help provide feedback for the students who have completed these projects. And then the students can keep completing projects, right? And as your interests evolve. So the goal isn't just to complete an assignment, it's to build a portfolio, right? So if you find in this program that your passion is cardiology, maybe you do 2 or 3 different projects in cardiology to show that you've like really deeply engaged in this one specific thing. So I want to just show you quickly into our project hub. You can browse hundreds of projects. So for example, there's, I think, an example here. Yeah, so maybe you pick a project that aligns with your interest, right? So maybe your interest is pulmonology, which is doctors of the lungs, lung disease. So you like asthma, and you pick this project, which is already listed for you and gives you some type of structure. A lot of students are very motivated, but they don't have the knowledge to know where to start, right? The curriculum prepares you, like you will know a lot about asthma. So you'll feel equipped. You'll know how to do medical research on PubMed because we'll have taught you in the program. And so you'll be feeling good about it, and you'll pick a project that interests you, right? So maybe it's this one, how social determinants of health impact asthma. across different communities. You get the description, your word count or your slide count, and some publication options. Okay. And so then you can complete that project and submit it for physician feedback. You can also, I know there were some questions in the chat about how do you find a passion project? If you already have a passion, or maybe through the curriculum you discover one, right? You're like, wow, it was so interesting learning about rheumatoid arthritis. I want to do a project on that, but there isn't one in the project hub maybe. Then you can propose your own project. So you're not limited by, I mean, there's over 150 projects in there, so there's plenty to choose from and it's regularly updated, but you're not limited, right? So you can do whatever you kind of set your mind to do. Or if you have a very niche interest, we can support you. Okay, and so then once you've completed your project, you can share your work. So we do not guarantee publication or presentation because we are a merit-based program that allows us to maintain prestige on medical school applications and college applications. And so we don't guarantee that you will have these opportunities, but many of our students are extremely motivated and do get to do these opportunities. So we partner with a variety of medical blogs, educational websites, patient education platforms, medical literacy initiatives, and we publish our student work when our student work is exceptional, right? So if you've written an exceptional paper about how to prevent heart attack, we may offer the opportunity to publish it for you in the Medical Literacy Initiative magazine, for example. You can also submit your work for the opportunity to present at the Emerging Physicians Conference, which is a physician-reviewed national conference that Docera hosts every January. It's completely virtual, so there's no cost to you to kind of like, we don't want to exclude anyone from travel costs or anything, so it's virtual. Anyone can attend, anyone can submit. Even if you're not in a Docera program, this is a great opportunity for you that you can submit a project. And you can present your work before physicians, medical educators, fellow pre-meds or high schoolers, and it can help you develop those communication skills that are essential to a career in medicine, right? Presenting is a super important skill. It's highly viewed by admissions committees. And then selected presenters are eligible for awards and recognition. So we have some cash prizes for like best presentation and stuff like that. And I see in the chat when's the deadline. So our conference deadline is in mid-November. So yes, we can, let's see here. We can talk about the August cohort. So most of our students, like if you complete the program, you will have a project to submit, right? So we support our students through creating projects. As long as you're self-motivated, you will have made something that you can submit. Like I said, we don't accept everything. It's merit-based, but the students who do complete our program have something to show for it and something to submit for publication and presentation. So the types of projects, I guess that is all to say, the types of projects that you create with Docera are the types of projects we look for in the Docera Emerging Physician Conference. Okay. So you can join our August 2026 cohort still. We have, I believe, 4 or 5 seats left. We have a few different options for you to get involved with this. Our August cohort, the medical intensive, is the most intense version of the Docera program. There are less intense versions that are self-paced, which we can talk about. But the medical intensive program, you would learn medicine live with me from 7 to 8:30 p.m. from August 3rd to 13th on Monday to Thursday, right? So it's 8 sessions, an hour and a half each. It is an intense 2 weeks, right? It is a rigorous program that is designed to be like a boot camp where you come out the other end and you've grown a lot, okay? And it's kind of like an immersive experience where you will kind of transform in a way as a pre-med. We accept anyone from 9th grade to 12th grade, and we also have several undergraduate students in our programs. So there is really no age gap other than the fact that you need to be a 9th grader or above. Yeah, and so in the medical intensive, you can complete up to 3 projects from our project hub and get physician guidance on all of those. While the live classes are stacked August 3 to 13th, after the 13th is when you can start doing projects, and that access to the project hub never expires, right? So I know that around mid-August, school starts back up. It can be a busy time. You absolutely do not have to start your projects then. You have years and years to complete them. So if you want to wait until December when you're more settled and then you start your projects, that's totally okay. We're always here. Okay. And it is a small group cohort. I know it says 8 seats on here. I should have updated it. We only have about 4 or 5 left. And there is a cost associated with it. There is other options. And then there's a whole other thing to talk about in a second. So Elevate and Launch are our 2 other programs that are self-paced, meaning you won't sit on Zoom with me. You would watch pre-recorded lecture videos that I have made teaching you the same curriculum, so the same content, and you would still get to complete projects. In Launch, you complete 1 project, and Elevate, you complete up to 3. And you can start those programs tonight, for example. You don't have to wait until August or a specific date. The self-paced programs you can start whenever. So, if you're not ready yet for those programs, because they are rigorous programs, right? They're for people who are really looking to dive into the next step, deeply engage with medicine, complete some projects, maybe do some passion projects. If you're not ready for that yet, that's okay. We have another option, which is called the Future Physician Society, which I think all of you would really benefit from. It is a very flexible, low-cost way to continue learning medicine year-round, okay? And so if you're someone who hasn't found a way to get shadowing opportunities yet, doesn't know where to start, this is a great place to start, okay? As a member, you get live physician-led educational sessions every month, and pretty soon they're going to be every week. Right now, they're twice a month. Okay, and they're hosted by me and other guest physician speakers, predominantly me, but we do have some other guests that come from other specialties of medicine, other resident doctors. And as a member, you get live physician-led educational sessions every month. So just like the intensive program, we sit on Zoom and we learn a live topic. So our most recent one was dementia and the aging brain. And next week, we're talking about how cells become cancer. And then in a few weeks after that, we're talking about cirrhosis and liver transplant, just to give you some ideas of the topics we talk about, right? So it's really in-depth learning medicine. We do clinical case discussions. We deep dive into certain diseases. Sometimes we have bonus sessions, right? We had one last week where it was just kind of a hangout session where we got to talk about what life as a resident is really like. We went over what all the different specialties of medicine, what it looks like to be a resident in those specialties, what your day-to-day life would be like, and how competitive certain specialties are, and had a Q&A section. So sometimes we have those events, but predominantly this is an opportunity for you to learn medicine. Okay, and it's you also get this like community of students, right, who are also passionate about medicine and have the same goals. And so it's good for students who want to explore medicine more deeply, learn how physicians think, and stay engaged throughout the year. Okay, and this is a more accessible program. All right, and you can learn more on our website here. Okay, so thank you so much for attending. I appreciate all of your patience. We have 22 minutes for live Q&A. And let's see. Anybody who wants to, oh, I see some people putting the questions in the chat. If possible, try to put your questions in the Google form, but I will also look